That hesitation when you stand up is not normal aging. It's your body losing confidence. When movement starts to feel uncertain, the nervous system switches into protection mode. And a body in protection mode does not support strength, energy, or healthy testosterone levels. Today, I'll show you 6 simple stretches that restore control where men lose it first. No intensity, no strain, just positions that teach the body it's safe to be strong again. Stretch 1. Seated hip internal rotation. Sit down on the floor and bring your legs into a 90-degree position, one in front of you and one behind. Before you move, pause and feel the ground supporting your weight. This short pause matters because it signals to the nervous system that movement will be slow, controlled, and safe. Begin rotating the legs to the opposite side, allowing the knees to fall naturally as the hips turn. Do not force the range and do not rush the transition. Keep the spine tall, the shoulders relaxed, and breathe quietly through the nose. Move back and forth with control. 6 to 8 repetitions on each side. If stiffness appears, do not fight it. Stay calm and let the hips explore the range they are willing to give today. Hip internal rotation is one of the first movements men lose after 50. When it disappears, the pelvis stiffens and walking becomes cautious. This cautious movement tells the nervous system to protect. Restoring rotation restores confidence. As the hips move more freely, balance improves, breathing deepens, and tension around the pelvis begins to fade. This stretch teaches the body that rotation is safe again, helping the nervous system release unnecessary protection. Stretch 2. Half-kneeling hip flexor stretch. Kneel on the floor with one knee down and the opposite foot placed forward. Before stretching, set your position carefully. Gently squeeze the glute of the back leg and bring your ribs down so they stack naturally over the pelvis. This alignment matters more than how far you stretch. Once stable, shift the hips forward slightly until you feel tension across the front of the hip. Do not arch the lower back. Keep the chest quiet and the shoulders relaxed. Breathe slowly through the nose as you hold the position. Stay here for 30 to 45 seconds on each side. With every breath out, allow the front of the hip to soften rather than forcing it to open. Tight hip flexors are common after 50 because of years of sitting, driving, and forward-leaning posture. When these muscles remain shortened, the pelvis tilts forward, and the body stays in a low-level stress position. This stretch reverses that pattern. As the hips open, posture improves, breathing deepens, and tension through the lower back decreases. The nervous system reads this as safety, allowing the body to relax and restore confidence in upright movement. Stretch 3. Deep squat hold. Stand with your feet slightly wider than hip width and turn the toes out gently. Lower yourself slowly into a deep squat, allowing the hips to sink between the legs. Keep the heels flat on the ground and let the chest stay tall as the spine lengthens upward. Before holding the position, make small adjustments. Shift your weight evenly across both feet. Let the knees track naturally outward. Relax the jaw and shoulders. These details tell the nervous system that the position is stable. Hold the squat for 20 to 40 seconds. Breathe slowly through the nose and resist the urge to rush out. If tension appears, do not force relaxation. Stay present and allow the body to settle on its own. The deep squat is not a leg stretch. It is a full body stability check. Ankles, knees, hips, spine, and balance are all evaluated at once. When this position feels controlled, the nervous system receives a powerful message of safety. As safety increases, unnecessary tension fades. Movement becomes more confident, breathing becomes calmer, and the body stops bracing against itself. This calm stability is a key signal that supports strength, energy, and healthy testosterone function over time. Stretch 4. Deep squat with controlled reach. Begin in the same deep squat position as the previous stretch. feet grounded, heels down, chest tall, and spine long. Before adding movement, take one calm breath to reestablish balance. Place one hand lightly on the floor in front of you for support. From this stable base, slowly rotate the opposite arm upward. Let the eyes follow the moving hand as the upper back turns. Move only as far as you can control without shifting the feet or collapsing the posture. Pause briefly at the top, then return the hand to the floor with the same level of control. Perform 4 to 6 slow repetitions on one side before switching. This movement teaches the body how to rotate while staying grounded. Many men lose this ability over time, which causes the nervous system to tighten during everyday tasks like reaching, turning, or changing direction. By rotating from a stable squat, the body learns that movement can happen without losing balance. Integration between the hips, spine, and shoulders improves. As coordination returns, effort decreases and confidence increases. This calm, controlled motion reduces internal stress and reinforces the sense that the body is capable, stable, and safe to move freely again. Stretch 5. Standing calf and ankle stretch. Stand facing a wall with one foot back and the heel pressed firmly into the floor. Before leaning forward, soften the knees and feel your weight spread evenly through the foot. Lean forward slowly until you feel a stretch through the calf and around the ankle. Keep the heel down, the toes relaxed, and the spine tall. Hold for 30 seconds, breathing quietly through the nose. Switch sides and repeat. Ankle mobility plays a major role in balance and confidence. When the ankles stiffen, the nervous system increases tension higher up the body. This creates guarded movement, shallow breathing, and unnecessary effort. By restoring calf and ankle length, the body regains a stable foundation. As balance improves, the nervous system relaxes. Relaxation supports recovery, and recovery supports healthy hormone signaling. Strong foundations reduce hesitation, making everyday movement feel smooth, efficient, and controlled. Practice this drill daily. Move slowly and stop before pain, letting comfort guide range and pace every session for consistent, lasting results without strain or fatigue building up unnecessarily. Stretch 6. Supported hip hinge hold. Stand tall with feet hip-width apart and place your hands lightly on your thighs or on a chair in front of you for support. Before moving, take one slow breath and soften the knees slightly. Begin hinging at the hips by pushing them back, not down. Keep the spine long, chest quiet, and neck relaxed as your torso inclines forward. Stop when you feel tension through the back of the hips and hamstrings without strain. Hold this position for 20 to 30 seconds while breathing slowly through the nose. With each breath out, allow the hips to settle backward rather than forcing depth. Many men lose confidence bending forward after 50. Fear of the lower back creates tension before movement even begins. This protective pattern limits strength and drains energy. The supported hip hinge retrains safe loading. Support removes threat, allowing the nervous system to relax while the hips learn to move again. As confidence returns, bending feels smooth instead of guarded. This stretch improves coordination between hips, spine, and breath, restoring trust in one of the body's most fundamental movement patterns. Strength does not disappear because of age. Confidence does. And when confidence fades, the body quietly shifts into protection mode. Movement becomes cautious. Breathing shortens. Energy drops. These 6 stretches are not about flexibility. They are about restoring trust between your brain and your body. When the body feels safe again, it stops bracing. When it stops bracing, strength returns naturally. And when strength returns, healthy testosterone signaling can follow. Practice this sequence 3 to 5 times per week. Move slowly. Breathe calmly. If this session helped you, leave a comment with your age and where you're watching from. Your body is not broken. It has simply been waiting for the right signals. I'll see you in the next session.